Much of the summer, we have been balancing the challenges presented by the pandemic. We have continued to care for COVID patients, although the numbers lower than what we've seen in wave 3. We've been working very hard to ramp up on our surgical and procedural activities as well across our sites. We do continue to have the satellite health facility available to us. It is available at this point till the end of March, and we're very happy with that. And we look at every opportunity to maximize the beds that we have available there to us.
At a minimum, this directive requires that staff, physicians, contractors, learners, students, and volunteers do one of 3 things: provide proof of full vaccination against COVID-19, and full vaccination is defined; provide written proof of a medical reason for not being fully vaccinated; or undergo regular testing. There's also an educational component that you'll see in that directive, and more to come definitely on that. We're aiming for September 1st for mandatory reporting. So we've got about half of our staff and physicians right now who have reported their vaccination status. I cannot ask you enough. Please report your vaccination status. We encourage everyone to be vaccinated. The link is there on how to report, and it's also on the hub and in various communications.
We are currently the public health unit with the highest numbers per population. However, also our growth has leveled off a little bit. So we continue to be in that range of somewhere between 40 and 50 cases per day, but we saw a significant increase over the last week. When you're looking at what happens globally, you see very different patterns. And this adds to all that uncertainty in terms of what can or should or have we to expect locally. And I think it goes back to prepare for the worst and hope for the best.
While we're going to be moving out of the large clinic business in Hamilton at the end of this month, there will continue to be so many different mechanisms through primary care pharmacy, pop-up clinics, mobile buses, school clinics starting this weekend, et cetera, where you, your family, your friends can go and get your vaccine. So you can see my message there. It's still available and accessible. Get yours.
It's really a terrific opportunity for our staff to be the go-to person for Epic in their clinical area, and also to provide guidance to their colleagues during those first few days and weeks of the Epic Go Live. So if you're interested, or you know folks who are interested who want to put up their hand, this is just now an expression of interest. There's no commitment, and we recognize that we're asking this in a difficult time, but I would emphasize that this is for next spring. Please go to the Odyssey page and look for the form, and it will come to us and come to your manager at the same time.